Okay. Good morning. I am Laura Shaughnessy. I serve as the chair of the Professional Advisory Committee for the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Jim Kilmartin.
Present.
Good morning. Harriet
Good morning.
Bachner.
I'm here.
Good morning.
Good morning.
Melissa Briggs.
I just saw Melissa Briggs enter the waiting room, so she should be joining us here in a couple moments.
Okay, great. We'll jump back to her in a minute. Michael Countryman.
Here.
Good morning.
Morning.
Morning. Asha Goris.
I don't see Asha yet.
Okay, hopefully he'll come. Bob Kircher.
I'm here.
Morning, Bob.
Morning.
Vanessa Perez. No Vanessa yet. Andrew Secor.
And I don't see Andrew yet as well.
Okay. Adil Torres Rivera.
Yeah.
Good morning, Adil.
One.
Great. And have we had any other people join since we did roll call? Did you say Melissa?
Melissa is present now.
Good morning, Melissa.
Good morning.
Great. Anybody else jump in here that we haven't named?
No, I don't believe so, but I'll keep an eye on the waiting room and I'll let you know if someone else joins.
Thank you so much. Okay, I note the following BSRB staff members are also present. David Fye, good morning.
Here. Good morning.
Leslie Allen,
Here.
good morning.
Good morning.
Good morning. Is there anybody else present that we haven't named?
No, I don't believe so.
Okay, terrific. David Fye will now read a message concerning this meeting being held remotely.
Okay, thank you, Laura. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about their concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment or answer questions could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested to provide public comment. Because we are conducting this meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended, so we will be conducting this meeting pursuant to the KOMA. On April 23rd, 2024, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And Leslie Andrew Secor is in attendance as well. Also, I did check the conference call line before we started. There's no one currently on the conference call line, but if I hear someone beep in by that method, I will let you know.
Thank you, David, and good morning, Andrew.
Good morning, everybody.
Hi there. Okay, the meeting is now called to order, and the advisory committee will begin its discussion of its first item on the agenda, which is, of course, agenda approval. You all received the agenda in your packet that David Fye sent. Does anybody have any questions? And if not, I'll need a motion and a second to approve the agenda.
I move to approve the agenda.
Thank you, Andrew. I need a second.
Second.
Who was that, Bob? And that was Jim.
I think it was Jim. Yep.
Okay, thank you, Jim. All in favor, say aye.
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 'Aye. Aye. 'Aye. 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 Okay, the agenda is adopted. The next thing we will do is review and approval of the minutes from our last meeting that was held on April 1st. You received those in your packet as well from David. Does anybody have any questions or changes that need to be addressed? And if not, I need a motion and a second to approve the meeting notes.
I'd make that motion.
Thank you, Michael.
And I'll second it. This is Bob.
Thank you, Bob. Okay, all in favor of approving the minutes, say aye.
Aye.
Okay, opposed, same sign. Okay, those are adopted. Thank you for that. Okay, the executive director's report. David Fye, it is all yours.
All right, thank you, Laura. And just to let you know, Vanessa Perez has entered the meeting as well, so she's in attendance as well.
Oh, terrific. Good morning, Vanessa.
Good morning. My apologies for being late.
We're not. We're glad you're here. Thank you.
Well, I will provide a brief report, some of the operations of the BSRB, and we'll talk about a couple legislative updates, and then we'll talk about a couple items from the last board meeting as well. So first, in terms of an operations update, I wanted to let you know about something that's a really interesting opportunity. I had been reached out to by representatives of the Kansas Department for Aging and Disability Services. There is a national organization called NASHB, and they make available essentially policy academies is what they call them. And it's an opportunity for states to work with staff at a national level, collect research and brainstorm ideas. This one was an opportunity to work with individuals at a national level looking at workforce development and the mental health areas. And so KDADS, or the Department for Aging and Disability Services, was looking to partner with some other state agencies. And so it'll be KDADS, BSRB, and also representatives from the Board of Regents. And we applied for that policy academy. We were awarded that. So we'll be working with individuals at the national level for the next couple of years, meeting with them periodically. But hopefully the idea would be at the end of this, we would be able to bring forward some creative solutions. Some of this may not directly involve the BSRB, but kind of taking a look at a much of broad terms and broad solutions. For example, some of this might look at bringing a proposal to the legislature to ask for additional tuition reimbursement for individuals entering the pipeline at, kind of the lower level when they're entering school. But it could involve looking at creating new types of licenses that maybe some states have explored as a way to get people into the pipeline at a younger age. So I will keep you all updated on the work of this policy academy, but very happy to work with those other agencies too. It's a nice opportunity for us to partner with some other state agencies to kind of bring some solutions to the table as the legislature is looking at addressing workforce in the upcoming years. And in terms of some other operations updates, if you have not visited the BSRB website in the last month or so, I would encourage you to do so. We have replaced our website. We are now under a new platform with Granicus. There's a number of state agencies moving under the Granicus platform. And part of the reasons that we had moved, so the state was trying to put more of an emphasis on individuals being able to access information a little bit more cleanly, and also for individuals using mobile devices to be able to access some of the information. So it did take quite a bit of work behind the scenes, meeting with representatives with the Department of Information Technology Services and also with Granicus. But we have a very clean website now. The same functionality we had before, I think most of that has been preserved. But if you get a chance, I would take a look at it. If you do see any issues with it, please let us know. We've been having good conversations with Granicus and OITS as we've worked through a couple of minor issues, but in general, it's been a very smooth transition. So happy to report about that. And then also I wanted to let you know, recently we reached an agreement to begin services with a company called CE Broker. I think I've talked about this in the past. The CE Broker is a private company that is able to partner with state agencies in different states to offer their licensees a free option to upload documentation of completion of continuing education hours. And why this is important is we audit 10% of all our licensees at renew. And when they renew their license, we ask them to provide proof they've completed their hours. And so sometimes that back and forth can mean them mailing a lot of certificates or other documentation to our office. It does take a little bit of time. Our staff would review a lot of that information. Under the new proposal with the e-broker, individuals can upload their documentation in advance, and they can find access to other CEs that way as well. It is free to the state agency. It is free to licensees. It is a voluntary type thing, so no one has to sign up for an account, but I think it'll be to individuals' benefit to do so. That way, if they are audited, they don't have to look for the documentation from maybe 2 years ago to demonstrate they completed their hours. So it should be a helpful new service. We have been working with them to kind of figure out the time frame of the implementation. I think what they're going to do first is focus on one profession, then move to others. So the one they've targeted first is professional counseling. I don't know how soon they'll be able to set that up, but that is the first profession they'll be working on. And we haven't reached the finalized agreement, so everything has now been taken care of. It's just about working with our licensing system provider and CE broker and making sure that it's all set up before we officially launch it. But whenever that is ready, we'll send something out to all the licensees to know what the process will mean for them and how they can create accounts. Moving next to some legislative updates. There's 2 bills I want to make you aware of. We have wrapped up the legislative session that has concluded. There is a special session the governor has called, and that will be coming up in June. But the primary focus of that special session appears to be tax relief. So, while they could look at other issues too, it seems like that will be the main primary focus of the special session. So in terms of BSRB related items, the 2 items I wanted to highlight for you, the Social Work Multi-State Compact did pass. That was House Bill 2484. I can't give you a time frame on when that will be implemented, but Kansas was the 7th state to pass that compact. That was the number of states necessary for the Rules Committee to start meeting this fall to work out the operating rules of the compact. So that is something that will take place. A few other states did pass it after Kansas this year. So there will be several states with representation at those meetings. And that'll be something we'll be working on this fall. Another bill I want to make you aware of was House Bill 2745. That was a bill that did pass the legislature this year. What that bill does, it exempts military spouses of active military service members from occupational licensing fees. So what that bill was targeted for is for basically the spouses of active duty military members won't have to pay if they apply for licensure in Kansas through the BSRB or other professional occupational licensing agencies. And then when they renew their license, they won't have to pay that either, as long as their spouse is an active duty military. So that is something that's going to be a nice benefit to active duty military spouses. It will cause an effect on revenue for the BSRB. So when the board does meet in July and September to look at possible fee adjustments, that is going to be something that will play a factor. There have been a number of different things that have adjusted our anticipated revenues and expenditures. And so I did want to make you aware of that. It is a nice benefit for the spouses of active duty military members, but it will have an effect on revenue for the BSRB, since we will no longer be collecting those for individuals that request that in those situations. And that bill became effective, or will become effective, as of July 1st. So we're right now trying to implement those provisions to make sure that'll be a smooth transition as well. In terms of an association update, I just want to let you know at the end of June, I'll be attending the National Board for Certified Counselors Conference. That will be in Puerto Rico this year. And so I'll be attending on behalf of the BSRB, and I'll collect information at that conference and go ahead and bring it back and share it with you all at the next meeting. Moving next to a couple of items from the last board meeting. The board recently met on May 13th. There was a bill this year that was Senate Bill 233 that an individual from the public did want to present public comment on. That bill was ultimately vetoed, and the legislature attempted to override the veto, but the override failed. So Senate Bill 233 is not enacted. But there was public comment on that bill. It had to do with gender transition and how it could affect individuals who provide services to certain types of clients in certain situations. And so a lot of it was directed at the Board of Healing Arts, but it could have an effect on, potentially on providers under the BSRB as well. The individual providing public comment encouraged the board to look for bills like that in the future and maybe to take a stance on some of the legislation. So, some other items from that board meeting, the board did do a roll call vote on a number of regulations to formally adopt those. These are regulations that have been going through the process for a little bit of time now, but we're almost at the finish line. These have to do with some of the in-residence changes and others. There's about 11 different regulations that we are moving towards finishing. There's a legislative committee that had reviewed these regulations and had requested some more information in terms of the definitions. We had used the term synchronous video conferencing as a replacement for the previous the current standard, which was for individuals who receive their education from non-accredited schools, a certain amount of the coursework would need to be received while they were physically at the school in front of core faculty. The new language opens that up and allows those hours to be received either in front of core faculty in person at the institution or by face-to-face synchronous video conferencing. So the board did vote to add some clarifying language to the term synchronous video conferencing. And then for the addiction counseling profession, there was a recommendation the board had voted to adopt, replacing one of the instances of substance use with biopsychosocial, and the legislative committee had requested clarifying language on that term. And so the board did vote to adopt some language just further clarifying that would be the biological, psychological, and social well-being of the person. So. But since the board did do a roll call vote to adopt those with the post-hearing changes, we have been working with the Secretary of State's office to get those published. Secretary of State's office has informed us they will be published in the Kansas Register on Thursday, June 6th. So once they're published, it's 15 days after that when they are effective. So basically 15 days after June 6th, we'll be able to start using the new provisions in those regulations. And if you would like to see, just as a refresher, any of those changes, they're on our website under a link, statutes and regulations. There's a sublink of proposed regulations, and you can see all of those there, as well as an economic impact statement that describes each one of the changes for each one of the professions. There were also a number of individuals reappointed to advisory committees at the last board meeting. So I'm happy to report that Melissa Briggs, Michael Countryman, and Vanessa Perez were all reappointed to a new 2-year term. And those terms go on fiscal year. So they will be starting their new term officially on July 1st, and that will go until June 30th, 2026. And then terms are staggered. And so any individuals who are not of this year but still have terms remaining are able to request reappointment next year. And so I'll be getting in touch with any members who are eligible for reappointment next year. So you'll have information on that. In terms of the Kansas Fights Addiction Grant Review Board, the board does have an appointee to serve as a member of that board. And at the board meeting, the board did reappoint Jason Hess to continue to serve as the board's appointee to the Kansas Fights Addiction Grant Review Board. That term is basically something the board has decided on, should be a 2-year term by fiscal year. So Jason Hess will continue to serve as the board's appointee through June of 2026. There were several other items that took place during the board meeting, but you could go ahead and just take a look if you want to go on the website, look under the agenda for the board meeting in terms of what items were discussed. But with that, I'll go ahead and end my report and see if there's any questions.
Thank you, David. Any questions for David Fye? Okay.
I do have 2 questions, Laura.
Oh, yes. Thank you.
The first one is on the synchronous learning. What do you know what the changes were that were made to that definition?
Yes. So the members of the legislative committee had expressed a little bit of confusion on the terms synchronous, and really we were just meaning real time. And so what we did is instead of adding a definition and adjusting a lot of the difference to the language of the regulation, we just added a comma and said real time. So just trying to further clarify that when we were using the term synchronous, we were meaning real time.
Thank you. So for the purposes of continuing to be licensed in Kansas, if a person attends a non-K-Prep accredited online program that is asynchronous only, that person would still not meet the requirements then for licensure in Kansas, correct?
So currently there's sort of three paths. There's individuals who would attend a KCAP accredited program, and then there's individuals that could potentially make the argument that they attended a program that is not lower than KCAP standards. And then the sort of the third path would be that they attended a program that's not KCAP accredited and that program is not claiming to be not lower than KCAP standards. Then as of right now, they would need to have half of their hours in front of core faculty at the physical location of the school. Once the regulation goes into effect, they could replace that. Instead of being physically there, they could get all of their hours remotely, but half of the hours would have to be at least face-to-face by screen in front of the core faculty.
Yeah, so pretty much for any person that does an asynchronous program that's not accredited, because getting the KCAP accreditation component, saying you're not below the standard, which I know we also talked about removing that option because of the challenges associated with determining that,
Right.
that a person still not going through a KCAP accredited program would need to have half hours could be remote, half hours will still have to be synchronous in person or real time. Okay. The other question I have related to that is how are we going to determine or how are we going to get the information? If a person's saying right now, when I see syllabi and so forth, it says hybrid, it says synchronous sometimes, maybe it says asynchronous, sometimes it says nothing. How are we going to verify? Does the board have any idea how we're going to get that information for those review purposes for folks that are applying?
That's a good question. Right now, we do have the authority to send forms to the schools to collect certain information. So I believe once the regulation would go into effect, we would be modifying that form and probably asking them to have something provided either from the applicant or from the school, but I'm not sure. I'm not sure that we've worked through that one yet.
Okay,
Great question.
thank you. The other question I have is not related to something you mentioned here, but you mentioned things getting approved. Has there been any movement on our misconduct regulations that we've reviewed and had, at least I think this body approved them and heard them all? Have we seen any movement in terms of getting, I think the thing I'm wondering about is by the time these get approved, we might have a new code of ethics out. We might need to be changing these again. So I'm just curious what the time frame might be on getting some of these things updated.
Yeah, so that has not gone before the board yet. Some of the advisory committees completed their review and recommendations pretty early in the process, and then others were taking more time for that. So they have now all wrapped up their work on that. I expect that'll probably go to the board either at the July meeting or if not the July meeting, the September meeting.
Okay, thank you.
Thank you, Andrew.
And I was not being snarky when I said we might have a new code of ethics. What I meant by that is I know ACA revises code of
Sure.
ethics every, 10 years or so. I know there's been some talk of that. And so I just wasn't sure like by the time it came up. So that was not a sarcastic comment, by the way.
Oh, not at all. No, you're just keeping us updated on important changes. Is there a deadline for when those changes will be made known, or is that in the works?
Adil may be able to answer that question.
Yes, we are still working on it. We're very close. It's a whole bunch of moving parts. So I hope that by the end of the summer we have the ethics out. Okay.
Great, so pretty soon.
Yeah, I mean it's just being a long time overdue, so that's a different ball game. But yes, this is probably the most active committee in ACA, the ethics committee.
Right. David, will that impact what we need to vote on?
So it kind of depends on the process the board wants to take. So the next step really is for all of those packets to be presented back to the board with the recommendations from all the advisory committees. And then if the board wants to go ahead and just accept the changes, that can start moving through the process. Alternatively, the board could make other recommendations. Just kind of waiting to see kind of what the step the board wants to take. It wouldn't surprise me that when the board looks at all the changes, there might be some that were made in one advisory committee that were not made in the others, that there could be value in uniformity. We've seen that some of the advisory committees currently have a separate regulation for documentation as it relates to unprofessional conduct, and there's been sort of a method to roll those all into the unprofessional conduct regulation. But I think it's too early to tell, honestly, right now. However, there have not been a lot of changes to the unprofessional conduct regulations in the last several years, but minor changes could be put forward in future years too. So there could be an effort to kind of hold things and then to look at those changes, or there could be the board could say, let's go ahead and put forward all these changes because there's so many of them, and then we can tweak these based on modifications in the future. So right now, I'm not sure.
Okay. So I'm sure we can count on Adil and Andrew to update us when ACA comes out with their new codes of ethics so that we can really be up to date. I'm sure they
We'll be able to get you more. We're meeting this weekend, so.
Great. Well, good. Terrific. We'll look forward to hearing. It's an important time with AI and I mean all the other things that have come down the pike. It's, I'm sure, just so many changes are happening, and a decade. It hasn't been updated in 10 years, so it'd be really interesting to see how much it changes. Any other questions for David Fye? Okay, let's move on to item 5, updates on the counseling compact. I don't have any to add right now. It's in the works. We're looking at the end of the year to roll out the counseling compact. David, do you have any updates?
I did get an email from Greg Searles, who's the commissioner for the compact, and he mentioned in that correspondence that there's another state that has joined the compact, and I think one more maybe has passed legislation, but it hasn't become effective there yet. So we are getting very close to almost 40 states that are now part of the compact. I don't think it's reached 40 yet, but it's getting closer. So
That's terrific.
more states are looking to join the compact, and so that's all that I have really to report on that.
Great. Well, that's good news. Do you know who joined?
I don't. But I can find that though.
It doesn't matter.
The last one was Minnesota.
Minnesota. Okay.
Minnesota was
Yeah.
the last one.
We got 36 states. So,
Terrific.
and we were only shooting for 30, so we get 6 beyond and above.
That's terrific.
And we're in conversations with Puerto Rico too, so.
So David, when you're down there, twist some arms. Okay, let's move on to old business. Continued discussion for the questionnaire on professional counseling, and David Fye sent a template for where's the word? A sample for the questionnaire, and you got to look at it. And so let's go through any questions, any feedback that you have. David Fye, go ahead and take that away.
Okay. And I'll go ahead and I'll pull that up. And this is something that just to kind of frame this conversation. So the Social Work Advisory Committee has done surveys about every 3 or 4 years. There was one that was done just earlier this year. There was one that was done, I believe, in 2011 or 2021, and then another one that was done around 2015. But basically, they polled their licensees to ask questions related to different topics, sometimes supervision, sometimes other items related to licensure, any issues that it would help the work of the advisory committee to be aware of, so that way the advisory committee could look at possible changes to statutes, regulations. So with that in mind, I took some of the comments made by the advisory committee. The social work survey has basically been about 14 questions recently, so I tried to keep the questions to about the same length. Don't want to have it be too long, and then that way individuals may not complete the entire survey, but the most recent survey that social work had was we issued it to, I think, 8,288 licensees. And in the end, we had over 2,700 respond back to the survey. And for an optional survey, that was a really good response rate. Got a lot of good feedback from people about the survey, and a lot of people said they appreciated being able to provide feedback and answer those questions. So I'll share my screen here, and here are some questions that I thought might be helpful as a starting point. These are any of these questions we could change, but as a way to kind of start the conversation, that I'd kind of show you some options for questions. At the beginning here, there's some language that some of the members of the advisory committee said it might be helpful to make sure individuals know why we're giving the survey to them and what we hope to use the information we receive back. Why is it worth their time, in a sense, to complete this survey? And it really is valuable information for us. So we wanted to let them know this was coming from the Professional Counseling Advisory Committee for the BSRB. It's an optional survey. It's a short survey, but it will help us learn information as far as possible changes. Also, it usually, if the social work group has been sent out to permanent licensees. So these would be for the Professional Counseling Advisory Committee. This would be for the LPCs, licensed professional counselors, and licensed clinical professional counselors. So any of the permanent licensees. We usually would start off with some demographic questions. One of those asks, in what county or counties do you practice professional counseling? One of the reasons we frame it that way is if someone is looking to see if a county is represented, they can do a search in the report and try to find that particular county. Also, we have a number of individuals who live out of state, and that's a way for them to reflect that they may not just work in their out of state area, they may work in Kansas as well. So it gives us some information about that. We ask people, do you practice in a predominantly urban area, rural area, or frontier area? And also give people the option if they're unsure or they prefer not to answer. Thought it might be helpful to ask people what is the highest level of permanent professional counseling license they've obtained in Kansas. And we have the LPC license or the LCPC. And then how many years have you practiced professional counseling, combined years of experience in both the LPC or the LCPC license? And then if we can provide it in ranges, that is helpful versus just giving people a text box, because then we can have more charts that are a little easier to see. So thought maybe less than 1 year, at least 1 year, but less than 2 years, at least 2 years, but less than 5 years, at least 5 years, but less than 10, and over 10 years. Then the next set of questions focused on the Professional Counseling Multi-State Compact, and just included some language there referencing how the compact was passed in Kansas. Back in 2023, Kansas passed House Bill 2288, which added the multi-state compact, clarifying that it is for clinical level professional counselors, letting them know that the operating rules are still being finalized, but it's anticipated that sometime it may become operational in 2025. It talks a little bit about, under this compact, clinical level of professional counselors will need to maintain a permanent license in their home state, but will have the option to obtain a privilege to practice in other compact states as an alternative to a permanent license in those states. And that is by paying a separate fee to each state in which they wish to practice with that privilege to practice. Alternatively, it says licensees could choose to maintain their out-of-state permanent licenses instead of seeking a privilege to practice. And so then the next question would say it's for only the clinical level of licensees, including your LCPC license in Kansas. How many professional counseling permanent licenses do you currently hold combined between all states? 1 license, 2 licenses, 3 or 4 licenses, or 5 or more licenses, or prefer not to answer. And one of the reasons why we might ask this question is because engaging the impact of the Professional Counseling Compact, it's a little unclear to us how many individuals who live out of state may decide to not renew their Kansas license, but instead get a privilege to practice. And it may be difficult for us to collect that information, but one way to kind of get a sense of that could be to ask our individuals, how many licenses do you currently have between different states? And so that would let us know a little bit of how many people are licensed in not just Kansas, but also licensed in several other states. And then the next question is just for the clinical level.
I have a question about that one. So that only includes counseling licenses, not like marriage and family therapist licenses.
Correct. Yep. Mhm. Yeah, and I think there's been some conversation about a possible compact for marriage and family therapists, but I don't know that there's been the same level of support. So that compact, if it is created, is probably several years away. But yes, this would only be asking about licenses specifically in professional counseling. And then question 6, once the professional counseling multi-state compact becomes operational, do you think you will cease renewing your out-of-state professional counseling licenses and choose to seek a privilege to practice in those states instead? And thought we might say, yes, no, unsure, or prefer to answer. Question number 7 would be for the LPCs. How many years have you held a licensed professional counseling license in Kansas? And then give people a range of answers there. And question 8 is for LPCs who've held LPC license in Kansas. I put down for at least 2 years because the question is, are you taking steps to pursue a licensed clinical professional counseling license? If you are not taking steps to become an LCPC, could you explain why you've made that decision? And this goes to some of the comments from the advisory committee when we were talking about supervision and different things like that. There was a comment that some individuals may want to stay at the LPC level and may not be seeking the LCPC, may not be interested in pursuing a clinical level license, but we don't have a lot of good data right now on why those individuals would want to stay at the LPC permanent level of license, or perhaps how many of those individuals there would be. So this might help us kind of get some of that information. Question number 9 would be for both levels of license. Over the past 2 years, based on your observations and experience practicing professional counseling in Kansas, could you share information on any practice-related issues you have seen, such as areas where practitioners appeared to need more continuing education or training in a certain area? This is something the advisory committee members talked about the last meeting. This is a helpful question, I think, just to kind of let individuals share with us any issues they have seen. And then we can identify those problems and then discuss in the future, maybe some solutions to those issues. Question 10, if you are currently receiving clinical level supervision, have you experienced any issues receiving that supervision? If so, please elaborate on the issues you have experienced below. And then alternatively, question 11, if you are currently providing clinical level supervision, have you experienced any issues involved with providing that supervision? Question 12, question would be for clinical level practitioners. If you are a clinical level professional counselor, but not a board approved supervisor, could you please share why you have not sought to become a board approved supervisor? And that goes towards, we were looking at the numbers of how many individuals are at the clinical level, but there's a much smaller number that have become board approved supervisors. And it might be helpful for us to know why some individuals are not seeking to become board approved supervisors. Question 13 would be for both levels of license. Over the past 2 years, have you experienced any issues concerning telehealth, either through professional practice or observations of other practitioners? And then question 14, sort of the catch-all question that people had asked about before. Do you have any other comments or feedback you think would be helpful for the members of the Professional Counseling Advisory Committee of the BSRB to receive when evaluating possible changes to the statutes and regulations for the professional counseling profession? So if there was not something that we covered that would be helpful for them to share with the advisory committee, that might be a good opportunity for them to share comments as well. So these questions are definitely not in stone, but I thought it might be a good way to summarize a lot of the comments. I also tried to make these practice related questions so that it kind of fit under sort of a general theme. And as I mentioned, the social work one was 14 questions, so I kept this to 14 as well, even though there are a lot more subjects we could be asking about. But thought I'd go ahead and provide this to you today. And I went through this with Laura as well, just to kind of get her thoughts on it as well. And we wanted to kind of bring this to you as a starting point for discussion to see if these questions look like helpful questions, or if you have any suggestions on alternate phrasing or any question about why something is included. We can kind of open that up now for some discussion.
Thank you, David. Okay, feedback, questions?
I think it's a good beginning, and since once we get to try it run, we maybe get some more ideas on how we can play with but I think that at least what we can see give to us enough information about what's going on.
Yeah. Definitely.
There is a question regarding what type of area, urban, rural. I'm wondering about a question that would be about the type of counseling type of setting that they're working in, or maybe it's not a counseling setting, but university setting or some other type of setting that they may be in.
So I know in the advisory committee policy, it talks about our individuals in private practice or public or education. Do you think kind of that phrasing would help cover that?
Yes, and maybe people are even in a corporate setting as well, like in employee assistance for that matter.
Community mental health. Yeah. So an additional question that breaks those down, those areas of service.
Have we ever asked people about whether or not they work with managed care? I don't know if that's appropriate for this or not, but just wondering about people's accessibility.
Yeah.
I know I do, but there are a lot of folks that don't, and I don't know that we've ever asked or even gotten to understand why people may not, but that may not be what's, depending on licensure, that has an effect as well, like what level of license people are at for some. But it seems to be a common issue or question people ask, me at least.
I think it is a huge issue, and it is sometimes a deterrent for people because it's so unwieldy dealing with all of that. And then with Medicaid, Medicare, private insurance, fee for service without filing on reimbursement. I don't know if this is the place to get into all that, but it certainly does affect practice.
It's an important topic. It feels to me like that's a workforce issue, like that, those are workforce questions.
That's fine. Yeah. I just didn't know there was somewhere somebody, I've been curious about it for a while and consider research in the area, but didn't know if that was something for us to consider somewhere. Maybe not here, somewhere.
Laura, I think you're right. That's a workforce issue. But on the other hand, I like Andrew's point.
Right.
From a public perspective, we are being mandated by the state legislature to do this, take that, accept this, accept that. And I think it's important for us to know that not only the number of people practicing, how they practice, where they practice, but do they accept patients based on X, Y, and Z payee type? And so while it might not be something you put in it every year, it'd be nice to see where we are when
Mhm.
this survey goes out, just to see what the access is available to members of the public.
In my brain, this is an additional survey that we could even drill down and get more data with. How would you feel about that? A separate survey that really gets into some of the nuances of what you're after.
I remember being a professional working like you all do now in survey. Sometimes you get surveyed out.
Okay.
So survey, what is that called? I've been out of work so long.
Survey fatigue, maybe?
Survey fatigue. I'll take that. Thank you.
So a better option would be to include it here.
I think just as a
One or two
baseline, I
questions
like Andrew's
might
point.
just, oh, sorry. I think one or two questions might at least be the beginning of addressing that, and then to see the need to maybe go further at another time in another survey.
So what would the initial question be? What?
Well,
I just like Andrew's suggestion of, do you accept Medicare? And Harriet, Medicare, Medicaid, private insurance, self-insurance, private pay, self-pay. I mean, there's so many different types of pay. I think it'd be nice to see everybody check every box, but I will not be surprised when everybody doesn't check every box.
Right.
and possibly a question before that, like, well, maybe after that, about what are the obstacles that you may have encountered with receiving reimbursement.
Yeah, I don't know if
For some, it may be a deterrent to be in private practice.
Yeah, I think the question probably should be, the first one at least, is, are you an in-network provider with insurance or managed care? Because if you say, do you accept insurance or work with insurance, people that accept out-of-network benefits only would probably answer that question yes, because they do a super bill and then they send it on, but the patient's still responsible for the bill.
Right.
So I think you need to ask the question specifically about, if people are either handled with an insurance company, or are they considered an in-network provider with an insurance company, to really get what you're going for there. And then you could list, Medicare is a relatively recent one, so we'd see pretty low right now, probably because that we've just recently received, the beginning of the year, I think, with Medicare, but Medicaid and then other insurances we've had access to for some time. And my guess is there'll probably be some correlation between level of licensure and possible interaction with insurance or managed care as well. But I don't know. I've wondered about this. I've talked to Sharice David's folks about it before, and I guess I should say Representative David's, Congresswoman David's aides. And then I don't know how much the insurance commissioner has to do with that. I do know there's a lot of things we could get into with this, specifically even our reimbursement rates in Kansas compared to reimbursement rates of other states that reimburse more for people that work with managed care. Nebraska, for instance, being one that reimburses at a higher level than Kansas does. So it could be its whole separate survey at some point. But if you all, David and Laura and folks, think that it'd be appropriate to enter that question here, then fine. If it's better elsewhere, fine as well. I just wanted to raise the question itself.
Yeah, it's
Agreed.
challenging. My initial thought, these are all really good topics. Sometimes there's a little bit of confusion. We get phone calls occasionally. People ask us reimbursement type questions, and that's outside of our jurisdiction here. Usually it comes more through the Department for Health and Environment, KDHE. But sometimes we do all get asked to attend the same meetings and work together to resolve some of these issues. And so it certainly is a topic that is relevant. I guess the only other thing that I was thinking of is that if we if we collect information and we're asking about it, and then we don't have any way to influence change, I think potentially that could create an issue for some people because they may provide information and say, well, I gave you this feedback. Now, what are you doing about it? And if we don't have a way to do something about it, that's the only concern that I have is maybe it's helpful to kind of limit ourselves sometimes in terms of what jurisdiction we have. But I don't know. This is a good conversation. Those are just my initial thoughts in terms of how we can ask questions in this area and collect information and data that will be helpful. And I mentioned before that Policy Academy, there may be things that are outside of the BSRB, but if we're working with other agencies on changes in general, maybe it would be of value to collect some of this information as well. So.
I like the idea of collecting the information. It definitely, when you think about Policy Academy, KDHE, do any of us know if there's any active work on addressing reimbursement rates and workforce?
I know that there have been some conversations, and there are some programs that are already in place for certain types of professions. And maybe there will be more proposals in the future. I'm certain there will be. So so if nothing else, we could collect the information and then share that with other partners in the state. We'll probably clarify if people ask us that generally reimbursement is outside of our jurisdiction, but we understand, we're trying to be good partners working with other agencies in terms of coming up with solutions in terms of workforce too. So.
Yeah, and we have the opportunity to get the information.
Right.
Yeah. So what are we saying? We're adding certain questions that are going to get at this information?
Yeah, so what I am taking from the conversation so far is maybe look at some additional questions in terms of what types of settings individuals are working in terms of their different in terms of the different areas, and then the question that deals with what types of how are the payment that are being accepted contributing to the types of clients that practitioners are able to provide services to, such as network provider with insurance or managed care, accessibility in terms of Medicaid, Medicare, private pay, self-pay. Not exactly sure the wording on that, but basically something given those topics that were mentioned. And then also sort of an element of maybe what are some obstacles that have been encountered in terms of receiving reimbursement or something along that line as well. So.
I like the open-ended obstacles question because you never know what you're going to get. I mean, there are things that someone might be experiencing that we just don't know about. Any feedback about those questions?
Well, and there are people who work in a setting where they don't deal with that at all. They receive a paycheck dealt with by the administration of that setting.
Right.
I think it's important to have the context of the profession, and I don't know that there's any other way to do it other than ask it in a survey.
Yeah.
We don't know it otherwise.
Right.
And this exercise is somewhat a little unique. I mentioned social work. They've done surveys in the past every few years. But we, to my knowledge, have never done this type of survey for each of the professions, but I think it's a really valuable thing for us to do. And it's possible that we collect information and it really points us in some areas where we need to follow up and get more information in a future survey. I think as long as we limited this to maybe a once a year type thing, and we kept the survey short, I think we could avoid the survey fatigue factor, but also use as a new tool to help people, both practitioners and members of the public.
I agree. And we have so many things we're facing, so many changes. I think it's a terrific thing to conduct a survey like this on an ongoing basis. Any other feedback? Oh, go ahead, David.
I was just going to mention, I realize on the multi-state compact, it's tricky in terms of collecting information on that topic since it's not operational just quite yet. And some information, in terms of what a privilege to practice is, how much states might charge for a privilege to practice. There's lots of questions that are still out there that would influence people's answers. I just thought maybe some of these basic questions might be a nice way to collect information about what people think at this time without having more information. And then we could follow up in the future once the compact becomes active and more of the states have kind of figured out how they want to do the privileges to practice and things like that. So.
Right. Yeah, it'll be applied next time. No, terrific.
Depending on how people answer that question, well, yes, how people answer that question may depend on how well they understand the compact too, even beyond the fees. It's like you have a little synopsis, which makes sense to me because of how familiar I am with the compact. But for individuals who may still not be aware, have never attended a training, haven't read up about it, they may have confusion around what they're saying they were going to do. And so it's not to change this at all, but it's to say that the first round of getting information, there may be some effect just by people's lack of knowledge surrounding the compact process.
Yeah, agreed.
Yeah, it wouldn't surprise me if we have a high number of unsures by that one, just because it's, for a lot of people, it's hypothetical because it hasn't become active yet. But
any other questions or feedback about the questionnaire? Okay, thank you for your time on this very important topic. And now on to another topic that really proves that when you get data, you're surprised by the answer sometimes. We're going to talk about the board-approved supervisor. So David Fite, is there anything you want to share about that?
yes, just briefly. We've talked about this before, that there was some concern about individuals being unable to find supervisors. And we were looking at the number of board-approved supervisors compared to the number of permanent licensees that we have, both at the LPC level and also the LCPC. And it kind of brought into a conversation about why individuals are not seeking to become board-approved supervisors. And what we did in between the last advisory committee meeting and this meeting is Leslie Allen, the assistant director and licensing manager, she contacted all 250 of the board approved supervisors for professional counseling and essentially asked them, are you still providing supervision? Are you still open to taking additional people to provide supervision to? If you are not still providing supervision, would you like us to take you off the list? And Leslie, do you want to explain a little bit about the results that you got back when you sent that message out to all the board approved supervisors for professional counseling? Leslie, you're currently muted right now.
Hold on 1 second. I received hold on, it's taking a minute. I received messages from 113 counselors who said they were providing supervision. And some said, they had one slot, some had lots. There were, I would say, 5 or less that wanted to be removed from the list, and maybe 10 that were full. So I've been keeping track of that in an Excel spreadsheet. So when people say that they can't find anyone on the list, we now have a list of people we know are accepting supervisors. So we've been sending that out. We have not had any feedback from that yet. But that's the list we have now. So.
And Leslie, if my math is right, sounds like you heard back from a little under half the people who are board approved supervisors. So half of them did not respond to the optional kind of questionnaire that you provided. But of the ones that did, taking out the ones who are full or the ones who are no longer providing supervision, still seems like it's close to 100 people that would be willing to take on additional individuals and provide supervision.
That's correct. Over 100, yeah.
And that runs contrary to kind of what we've been hearing from people when they were asking for more flexibility. They basically were saying, in most cases, that they were just unable to find someone. And sometimes they even said, I've reached out and there doesn't seem to be anyone available. Now we do have at least data that shows something different. And we have a resource that we can provide to people as a tool to help them, that if they can't find a supervisor, we can give them almost 100 individuals. Now, that may not mean that they get the supervisor they want to work with, but under the current system, it would provide them a lot of options and of different resources in terms of someone to provide supervision. So I wanted to kind of, thought that was really valuable. It was somewhat surprising to us that there were so many people still willing to provide supervision. And so we wanted to kind of provide that back to you as just a note for future conversations along the board-approved supervisor topic.
Will you be sending out a follow-up survey to those who did not respond?
I don't know that we kept track. I mean, I'd have to go through all my deleted emails to see. I don't know. That would I guess be up to Dave.
We haven't talked about that yet. And I'm not sure. You know, we give people an optional questionnaire. It's not surprising that some people just don't respond to it. But I don't think we were planning to, but were you thinking there could be even more individuals wishing to provide supervision that didn't respond the first time we asked that question?
Yeah, there may be something that interfered with them being able to respond, or, you know, who knows, but there could be more. And then, you know, the area of the country, of the state also, where are most of the supervisors located? If somebody wants to have face-to-face supervision.
That the location is a problem.
Yeah.
In that people reach out from Garden City.
Mhm.
There aren't that many supervisors in that area. However, the board talked about that, and because all the supervision can be done by televideo, they consider that there are still supervisors available. So I don't think that wanting to be in person is considered an extenuating circumstance, at least at this time.
But Leslie or David, was it actually a formal survey that you sent out or just the email asking?
Just an email asking questions.
Okay. See, I didn't see a survey.
Yeah, I just
No.
responded during the meeting, Leslie, so you have one more.
Right, I just read it.
I'm one of the people that says I'm still providing supervision, but I'm full. But I do think for me, it was just missing. I went and had to search my emails like, oh, there is a thing right there. And so I responded back to it. But I think part of it was knowing how I wanted to respond. I think part of it was what I was thinking about, and I just ended up sending it back. But
yeah,
I respond, so you can click me on the list. I respond. I say yes. But I think that the follow-up piece probably, you know, will be. I know it's extra work, but follow-up probably is important, you know, because I saw the email just like Andrew did, and then I just make sure I say Leslie. I say, okay, so let me answer, okay. But it's because I know Leslie.
Yeah.
But you have, you know, I mean, and I know they have the official title, you know, with the board. But I think that maybe just a follow-up would be important, and you know, just my thought.
Okay. Well, we'll have some more discussion about that, and we'll try to look at the list of individuals who haven't responded yet, and maybe see if we can send them a follow-up or see if there was a reason we didn't hear back from them. So.
And to this point, I read about this in the minutes the last meeting, I would really, it'd have to be like a last ditch thing for us to roll back the expectation for supervision training, just because I ethically and so forth, like, and what people offer. I mean, I really would hate to roll back the requirements that we have for training. I saw the option of a test. Maybe something there too, but when I saw it, I was like, I really hope we don't go that route, because quality supervision is important. And being a good clinician doesn't mean you'll be a good supervisor, know anything about supervising. But then when it comes to supervision, I think part of it is just helping new professionals know how to get access to information, to who's available. And the thing about it, I found supervising folks, employers are becoming pretty flexible when it comes to giving people time, especially with the synchronous option. A lot of my folks, it's like their employers are more than willing to give them an hour a week at work to set aside for supervision. Some of them are paying for their supervision offsite. Other places are letting people leave early to go do in-person supervision if they want to meet with their supervisor every once in a while. So I'm seeing a lot of flexibility from employers, especially surrounding getting clinical supervision. So I would be curious to know more about why people are saying they can't get a supervisor unless it's just they're just not sure how to get access to them. But those are just some thoughts.
Well, and the survey does have a couple of questions on supervision, so maybe that'll provide more information for us too on that area.
Leslie, what are some of the reasons that people raise when they contact you about supervision? Not being able to find somebody.
Oh, yeah, they just, we send them the whole list, which includes everyone that's checked as an approved supervisor in the database. And they say, oh, we've contacted people and no one's available. Or the person, there's no one available that has the same type of experience, that I'm working in, or they're only working with kids or things like that. I was really, just off the bat in the first few days, we had almost 90 people respond saying they were available. So I can't imagine that they really did a thorough search of the people on the list and couldn't find anything.
Right. Didn't dig too deep. No,
Right.
that data is very important, and it really points to, Andrew, what you're talking about. Yeah, there are enough supervisors. They're out there. We didn't maybe have that information, but now we do. So the need to do away with approved supervisors or board, is really, it's arguable that we don't need to do that. So thank you for doing the research, Leslie, and putting the word out. You now have an updated list you can send right back to people when they say they can't find somebody. So that's terrific.
Yeah, thank you.
Thank you for that. Okay, moving on to our last piece of old business, reviewing 102.3.3a and considering the possible changes. David, what are your updates for that?
So we were talking a little bit about looking at requirements in other states, and I had a pretty good lengthy conversation with my counterpart in Missouri, and they are in the process of updating some of their regulations or rules for educational requirements for licensure. So they said they were close to having those finalized, and so basically probably what I would recommend for today's meeting is just pausing this conversation, and I'm hoping that those will be finished so that I can bring them back for the next meeting. But there's another advisory committee that was asking for sort of comparison as well, and Leslie was able to pull some information on some of those alternative types of licenses in different states. So we can try to look for some other requirements for professional counseling licensing in different states and bring that back. So for right now, what I would say is let's just keep this on the old business section of the agenda for a future meeting. But I did want to let you know that I had a conversation, and it sounds like some of the items that we are talking about, they're also talking about in other states, to making sure they have good standards for licensure. And Missouri does not have the 2 levels of licensure, so there were some differences between or LPC versus their clinical level of license. And they were asking some questions about how things are working with our 2 levels of licensure. So maybe we'll have some information at the next meeting as far as that goes as well with the survey.
So didn't Missouri come up with their new regulations? Weren't they published here within the last couple months?
I don't know if they're effective yet. It sounds like they were close to being finalized. But I'm not 100% sure if those have gone into effect or not. Leslie, do you know?
I believe they have, because I was looking for something and didn't know that they were changing to 60 hours, and it's in the regulation now. So
Yeah. Yeah, and it's available on their website, and you can download it from the website. It's changes it a lot actually for Missouri.
yeah, it does. So I can go out and get different states now and have them available for the next meeting.
Great, thank you for that.
Sure.
Now that I know those are published, I'm gonna go look at Missouri, so I can't wait to do that. Be doing that here in about an hour. Okay, new business. Do we want to go in the order that we have?
That would be good.
Okay, advisory committee membership. So this is always exciting to get new energy and new voices. So we asked that you all look at the resumes, the letters that were written, and bring to us. We have 3 positions to fill, up to 3. And being that we had 13 people, it seems to me that we could probably find some really good candidates from that list. And so our ask was to bring your top ones that you would like to recommend. So let's start that discussion. And then how do we vote on those, David Fye? Do we just kind of take a tabulation of who's recommended?
Yeah, so you are correct. There are after June 30th, there will be 3 open positions on the advisory committee. And I'll just kind of note one part of the advisory committee policy. I included that in your packet of materials as well. It does say under selection in the advisory committee policy, in reviewing nominations, the committee should work to ensure there is a diverse representation, including but not limited to geographic setting, gender, culture, and ethnicity. Members should provide representation of the levels of licensing for that discipline, and those members should be selected from among public and private practitioners and educators. So just some things to keep in mind when you're looking back over the individuals who applied for consideration. And there were 13 individuals who submitted materials this time around. And what you could do, what I've seen has been most effective, in my opinion, when individual advisory committees have been talking about new members, is they basically say which individuals stood out to them the most in reviewing the applicants. And then if there is a consensus from the advisory committee, then that would be fine. Alternatively, you could go ahead and take a vote. The only thing is, it says you can't do a private vote. So any kind of voting would have to be done, by raising hands or saying aye on individual people. But you're right, in terms of the number of people that could be added to the advisory committee, you could add up to 3. You could add fewer if you want. And then if you do reach recommendations today, what I normally do is I draft those recommendations in a letter. I provide it to the chair of the board. According to the advisory committee policy, the chair of the board has actual authority to appoint people to the advisory committee. So the advisory committee's authority is to make recommendations to the board. So you could make recommendations today. Those are forwarded to the chair of the board. And then if there's no issue, the chair of the board could appoint members at the July board meeting. So their first official meeting would be in the August meeting.
Great, thank you. Okay, so how do we begin? Does everybody want to just jump in with their top selections?
Well, one of the things that I was looking at was that the current membership of the committee is overwhelmingly LCPC. And if we're supposed to have some variation and representation, maybe we need to be looking at LPCs.
Okay, got it. Thank you for that feedback.
So I identified Amanda Wade and what's her name? Samantha Holloway as a couple that stood out to me in that category.
Great. Anyone else have those folks on at the top of your list?
I had Samantha Holloway as one of my selections. I also had Masha Megshwati
Maksudi?
Yes.
Mhm.
And Lindsay Dinkle.
Okay.
I got, I'm different from Bob, but what I was looking at here was also male and female. So it's only one male in the group, okay? So, looking in terms of diversity, so, I think that Dwight, I think that his name, make the pool based on terms of composition. So.
Yeah. Right.
And of course, I got Massa too, but Massa, I'm biased. I work with her. So,
Okay.
so my vote doesn't count.
Well, and just to clarify that too, I think it is helpful. We ask board members and advisory committee members to avoid things that could be considered a conflict of interest. However, when we're talking about recommendations for advisory committee members, given the different groups that you all may be involved with, it's not uncommon that you're going to know some of the applicants who apply. And so it's just kind of up to you. If you want to recuse yourself, you're welcome to. But if you think that knowing that individual and their ability to do different things or what makes them unique would be helpful for the advisory committee, it's kind of up to you if you want to recuse yourself or if you want to go ahead and put them forward based on what you know. So it's a little bit different in terms of conflict of interest when it comes to the advisory committees, just because sometimes there's so few applicants or so you're gonna know people in these areas. So
right.
Just for the again just for sake of Massa also happened to be Middle Eastern. Okay, so so that's in terms of diversity, in terms of what she does. I think that she also will bring something different to the board. So I just want to put that 2 cents, but again, I'm a little bit on the edge because again, I know her personally. I work with her, so.
I had Masa on my list as well for that reason. I like the diversity that she might be able to bring. And then I also had, I think it was Lindsay. She was the one in Larned. Yeah, Lindsay. And for the purposes of, I think more variety in viewpoints, I think being out there in rural Kansas.
I thought that was an important issue too, that we needed somebody in a rural area.
Definitely.
Now, I noticed on the application for Alex that he had some experience of getting his education in Missouri and also was in private practice. So I didn't know if he might be bringing something to the board that we need.
Does he practice in Kansas?
Well, it appeared that he did, but I think we'd have to confirm that.
Yeah, I didn't catch that when I was going through it. So I was just wondering.
I didn't either.
Left them. It was kind of hard to tell if they practiced in Kansas and they lived in other states and appeared to be licensed in Missouri. I think all of them were Missouri.
What was the last
Seems
name? And I'll look
important
it
to
up.
practice in Kansas to me.
Alex
McIntyre.
He signed his cover letter with an LCPC, so that wouldn't be Missouri.
Right. But even if I obviously work in Missouri or I work in Kansas, but when I do anything for Missouri, I always sign it with an LPC, even if I'm just anything like piece, because it confuses the other states when they don't have that.
Yeah,
I'm looking them up right now online.
yeah, it looks
He
like
might practice in both. It looks like, I mean, he's in
Yeah.
Kansas City,
it
so
looks like he's maybe a professor or something, or an adjunct professor for University of Missouri,
oh, here in
KCMO.
Kansas.
Mm-hmm.
The only work address he has in here is for Missouri.
Mm-hmm.
Yeah, he's been an LCPC in Kansas since 2017. But yeah, I guess doesn't work in Kansas, but he's licensed in Kansas for a while.
So, just as the public member, I defer to all of your expertise as far as evaluating people's accomplishments and qualifications. It's just a little bit far removed from me, but I do want to go back to something I think Bob said earlier, that we were light on LPCs. And are we focusing on LPCs or not, to kind of round out the group? Just a question for you all to discuss and consider. I'm willing to accept whatever the rest of the group advises.
I would say that it makes some sense to have an LPC, but I don't necessarily think we would fill all 3 spots with LPCs. Unless I mean, because the LPC on here was a relatively newer counselor. I guess it could be a different experience to see an LPC who's determined to stay in LPC their career, which is very different than you're moving to an LCPC, you're, a year or 2 into your plan. So I don't even think there were 3 of them. I wouldn't think LPCs would be like, yeah, I should join that board. Most of the time, I think they would be thinking they're too new in the profession. I would think. I would have thought that. So.
And I think we've all had the experience of being an LPC.
Right.
Well, and that's also depending on what state, because
Exactly. Yeah.
Yeah, I am LPC in Virginia, LPC in Puerto Rico, LPC in Michigan, LCPC here.
All different, right? Well, then they're PLPCs in that state. That's their equivalent, right? So.
Yeah. So I mean, so it's kind of like, so it's just really doesn't, other than the time in here, which is what Melissa's saying, okay? I don't think it make much of a difference.
And Samantha's was since 2020. I mean, she also got her PhD in counselor ed and so I mean, she's, I would say, fairly committed, but yeah, I mean, she's been an LPC for not quite 4 years yet, so it's not new, but newer. I want to say she had an expired one as well, but I don't know exactly when that one was. Oh, looks like it was a temporary license. So anyways, so she's been around for a little bit, and I'm familiar with Samantha as well. I'm familiar with a lot of people. I mean, there are a number of people on this list that I'm familiar with. So I'm open to however the board decides.
Well, Amanda Gardner, she has a lot of license. Like she has LCPC in Kansas and Maine, LPC in Colorado, Missouri, Michigan, Arizona.
Yeah, she works in private practice. She does all telehealth. So
Okay.
I know Amanda pretty well. She's a really good clinician. She's a good expert in anxiety, OCD, and prenatal work. So I know a couple of, at least Amanda, a few of them are pretty involved in KCA too. So I think some of them are exploring different ways to learn and be involved. I don't know. It's kind of a long list. It's kind of, I'm thinking we should pick 3 areas that we think would be good to fill and find one person that fits each of those areas. I like the diversity element. I like the rule. I think those are 2 really important. Those were 2 that stood out to me that we should fill those needs. I think we have do we have, is anyone on here in private practice solely? Like I do private practice, but not solely. I don't know if like what's the other gap that we may have? I don't feel like we have a university gap. I feel like we have pretty decent support of those that are teaching or.
Michelle Calvert's resume kind of stood out to me with her experience.
Mhm.
It's like she's working in community mental health, which I think brings a whole nother perspective
Mhm.
to the table.
For sure. It sounds like we are pretty unanimous on Masha Maksudi.
Mhm.
And what about, is it Lindsay Finkel, who's from rural Kansas?
Mhm.
Well, I noticed that she's also on an LMLP.
Mhm.
Yeah.
Yes.
So hers is mainly psychology, I think, but
Mhm.
Yeah.
I've been trying to keep check marks when people have been referenced. Um,
Amanda Wade is out in Pratt,
Mm.
and she is a counselor at a community college.
Yeah, it looked like Lindsay Dinkle was working at a state hospital.
you all are having a really good discussion, and I don't want to stall the discussion or distract the discussion. Seems like the people that I have heard referenced are Michelle Calvert, Lindsay Dinkle, Dwight Eisman, Samantha Holloway, Masha Mazdudi, Alex McIntyre, and Amanda Wade. That represent, and then of the individuals that I've heard kind of discussed, I guess the most frequently right now, Masha and Lindsay Dinkle, and then Samantha Holloway was one that I had heard a few
Mhm.
people reference.
Mhm.
But if there are others, like I said, it could be a consensus, or it could be that you identify a certain number and then you choose to vote between them. But it's kind of up to you. And I think it's been said, and you guys have had really good discussion so far. There's a number of things to talk about. You could talk about level of license. You could talk about geographic representation and other diversity factors to fit into play, certain areas, public, private, education. All those are really good things to take into consideration. So you've had a good discussion, but I would provide some feedback based on the check marks that I've taken so far.
One of the things that I also made note of with Samantha Holloway is that she does also have a school counseling experience or background. And I don't know, there's some insights that she may bring, from that kind of experience.
Yeah.
I don't think she's a school counselor currently, but apparently she had been.
As I look over Mazza, this individual really has the opportunity to bring a lot of different insights to the board.
For sure.
Looks like there's
Got his
practice.
master's degree in the same program that I went through in my doctorate at the University of North Texas. And he also did one of his internships at the appraisal center in Denton, where I did part of my doctoral internship there, and I supervised master's level people there. So it's like I have this experience from a long time ago at that same university and same facility. So I guess that also drew me to him. Like, well, I know that.
Yeah.
Mhm.
Masa is actually female.
A female.
Yeah.
I like the idea of Amanda Wade. She's LPC, and I like that she's out in Pratt.
So it sounds like Masa, Lindsay, and Amanda Wade. That's what it sounds like to me. Is that what it sounds like to everyone else?
I do have a little concern about Lindsay Dinkle just because her entire education is psychology,
Yeah.
forensic psychology, doctor in psychology, bachelor's in psychology, has an LCP, has the clinic counseling license, but training and identity even recently got a temporary LMLP. So I do wonder about counselor identity in some respects, given the entire education psychology with not counseling really not in any, at least from what the shows, not having any counseling education experience.
That
And I
would,
would- and I would
that would
agree
be
with that.
a red flag to me too, Andrea. I think the idea that it's two different professions regardless. And I think that the whole idea of being in this board is to watch out for the profession. So, so I think that also is a red flag for me.
Looks like she had counseling experience early on in her licensure and then has transitioned on to more higher level, looks like, from her resume.
What about, somebody had mentioned Dwight earlier. Then there's Alex, if we're wanting to make it more diverse.
I think Dwight might have the same psychology. He has a PhD in psychology also. He does have an MS in clinical mental health. I can't tell if was a psychology degree.
Yeah, it looks like a concentration, MS and concentration in clinical mental health counseling.
There is such a focus on the counselor identity in our field, and so that does present some issues as to where the focus is.
Yeah, I also do feel like school counselor identity looks a lot different than LPC identity. So
It does. I think it determines where you go to school. Like if you go to our program, our students are educated through a K-CREP, take all the core counseling classes. Whereas if you go to a program that is largely school counseling focused without a focus on like ACA and other things, that could be a factor. For Samantha, K-State is a K-CREP accredited PhD program. So there is that counselor identity component there. That you would have, but it really does, you're right, Melissa, it depends on where you go to school. How much of that identity is shaped by either ASCA school counseling perspectives or ACA and in counseling as well.
And the same thing I think goes with, with the psychology. If the focus is psychology rather than counseling specific, that impacts that identity greatly.
Yeah.
Or
Our
focus being on clinical.
Our program does both for trains for master level psychology and for LPCs, and it's quite different in that respect. The focus of the two programs.
I would say, although I agree with all those pieces, I think for an advisory board, though, it doesn't hurt to have some diversity in your lenses, even if you don't agree. I mean, one person's vote isn't going to shift the entire dynamic of the advisory board's ability to make any kind of recommendation. So I don't, although I think it may be something that knocks people out, I don't also think like we wouldn't say it's an automatic to some extent, because to me it's like, well, it's just a different voice with a different type of lens, and that might help us solidify even more how we believe this identity is so strong and necessary to come in a certain method of training. So I think we got it to 2. Now I think we're unsure of a third.
Well,
And I wrote down diversity, location. And I wrote population, but I don't know if we actually ever like population served as our priorities. But I don't know if that's actually accurate. I think it's probably more just location in the state for representation.
Melissa, which 2 did you say you have it down to?
I said them earlier, but now I don't know if I wrote them down the same. Masa and
And no, not Lindsay.
Michelle,
Michelle.
Amanda. It was
Amanda
Amanda.
Wade.
Yeah.
Okay.
Masa and Amanda were the
So
two. And then I also had Lindsay, but then we decided that wasn't hitting our area of focus.
Okay, so I wrote down Mazza and Amanda too. So
Yeah.
Amanda's the one in Pratt. Is that where Amanda is? She was
Yes.
covering that rural location
Yes.
need. Okay.
And then other strong contenders, I think, are Samantha Holloway, Alex McIntyre, is the only male left, I think.
and I would be fine
What's
with
the current
Alex.
balance? How many men, women are on the current team advisory board? I'm trying to count the people I'm moving.
5 men, not including David.
Yeah, so after June 30th, I believe there will be 3 females and 4 males.
Okay.
When we're looking at non-board members. And that's really what we're talking about in terms of the 10 non-board members. So
Hey, and also, I think it's really important to have multiple ethnic representation as well.
Mhm.
Hmm.
So I don't know. I think Mazza is good. I think Amanda's good. And then Samantha and Alex both sound really good. So
Yeah.
I'm good with any of those.
If we agree on most of that, we could certainly vote about the third position.
Okay.
So we're agreeing on Masha
Mm-hmm.
and Amanda Wade,
Wade.
not Amanda Petrick Gardner, but Amanda Wade.
Mm-hmm.
So those are the 2 that we are pretty much agreeing on.
Mm-hmm.
So then we would need to vote on a third.
On a third.
And the thirds would include Samantha Holloway, Alex McIntyre, those 2.
I'm sorry. What was Samantha's background again? I wanted to.
PhD, counselor education and supervision, MS in school counseling. Went to Washburn, teaches at K-State.
Okay. And then Alex, what was his? Maybe I remember.
He also teaches, I think, at KUMC and has a private practice. Looks like he has a Master of Arts in Counseling and Guidance.
Okay.
The one we weren't sure if practiced in Kansas.
Mm-hmm.
Okay.
I can't find Kansas practice for him.
Yeah, I can't either. I was looking.
He's been at Synergy for a long time, which is in Liberty. Looks like he's down. His Psychology Today profile has him down in the Crossroads.
Mm.
I think I've got my mind.
I'm sorry, Michael, what'd you say?
I said I think I've kind of got my mind made up.
You've got your mind made up?
Candidates.
Who is your
I have mine made up too.
I I just lean towards Samantha.
I do
Mostly
too.
because I like that school counseling background, that type
Yeah.
of stuff. I mean,
Yeah.
don't get me wrong, Alex sounds great too, but it's just, so that would be my vote.
Mine as well.
And mine as well.
Anyone else?
On Samantha?
On Samantha? Well, do we still need to vote for a third person, or are enough people tilting towards Samantha that we can just go with that?
My vote's for Samantha as well.
Okay,
I'm fine with that. I'm fine to say Samantha.
okay. So it sounds like we've got Masha Magsudi, Samantha Holloway, Amanda Wade.
Sound good to me.
Ah.
Well, thank you. I appreciate your in-depth review and thoughtful conversation. And what I will do is I will summarize your discussion in a letter. I'll make sure Laura gets a chance to take a look at it first before I provide it to the chair of the board. And then she will see it, and then she has the opportunity to follow up for more information if she has questions. And then if there's no other issues, she has the opportunity to appoint members to the advisory committee at the next board meeting in July.
Terrific. Terrific. Thank you so much for a robust conversation about all of this. That went really, really well. I'm always amazed at how that goes. It seems to always be easy and logical, and seems like a lot of us are on the same page. Okay, next thing. Oh boy. Discussion of regulation of artificial intelligence. And Adil, thank you so much for sending us the ACA guidelines. I don't know if any of you have gotten a chance to look at it, but boy, it sure is an important topic at an important time. And so we're going to be really hopefully referring to those guidelines as we continue our discussion. So David Fye, what do you want to frame for this?
So we're running into the last 15 minutes of the advisory committee meeting today. This topic and the next one on the agenda were two that the board briefly discussed as items that would be helpful for the advisory committees to start to have a conversation on. So maybe I can just frame this, and then most of the conversation can take place at the next advisory committee meeting. But you know, when we talk about unprofessional conduct, and most of the way that we have historically looked at our ability to regulate the professions, it has to do with a person. In fact, when you look at the educational regulations, sometimes schools will submit things to us and say, could you pre-approve this class, or could you take a look at our program? But if you look at the language of those education regulations, it's all through the lens of an individual applicant. And that's why artificial intelligence gets to be a little tricky, because we're regulating the subject matter independent sometimes of a person. And this is not unique to professional counseling. There's a lot of other professions that are starting to struggle with this. But part of this includes how artificial intelligence can be used as part of practice, ensuring things like confidentiality. But also there are entities or persons that are creating, apps that will provide counseling or other services. And there was a story in 60 Minutes that talked about artificial intelligence recently, and a few people contacted me about that. And so I know that it's becoming more prevalent. And the question has been, what is the role of regulatory boards first? And then when we have our role defined, how can we be helpful in this area to provide guidance to practitioners and make sure the public is being protected? And if there are issues with the artificial intelligence being used, how can we help do something in that area? So the American Association of State Counseling Boards is recently started to form a committee looking into this topic. And some other groups have weighed in on that before, but in Kansas, I don't know that the board has really taken a position on artificial intelligence. It would be helpful to have the advisory committees start to discuss this topic, collect some information, maybe provide some recommendations to the board in terms of how the board can address artificial intelligence. So hopefully that provides a little bit of framing. We don't have to have that conversation today. I'm sure it's a much larger conversation than what we have left time-wise, but kind of wanted to explain why it's on the agenda for today for you to think about for the next meeting.
David, also the committee for ACA and artificial intelligence, which is under my tenure, will continue. So they will come out with some other suggestions, that I can provide, again, because I think the time how we did this committee was only time frame. We didn't have any, we have only 6 months to put something out. And so now we decided to extend it for another 6 months. So there will be more recommendations coming out of that committee that we can use some guidelines if you wish.
I think that's great.
Adil, will you please share as there are updates that are made known?
Say it again?
Will you please share updates as they happen?
Yes, we like I said, we're meeting this weekend, so I'm pretty sure I have an update from my committees and so if I found anything that I think that can be useful, I put it out.
Thank you.
Okay.
Thank you. Whew, my head gets a little foggy when I think about this topic. It's so big and so important and such a shift, or it can be such a shift. And so I think this is going to be a very important ongoing conversation for us. We're going to be asked to have opinions and definitive opinions regarding a topic that will continue to change. So this will be the beginning of many conversations, I'm sure. Okay, next one. I think this one's actually a little more challenging. Talking about the description of counseling as a definition for our website.
Yeah, and this is something the board also recommended the advisory committees start to have a conversation on. So this has come up a few times over the years, but in terms of helping to make sure that we protect the public, there can be some confusion at times for members of the public and individuals who are not from these professions in terms of some of the differences between the different professions that we regulate. And we do share information on our website in terms of frequently asked questions, and we try to tackle some of these issues. This is one that we thought may be helpful to start with the advisory committees to try to come up with a good short explanation of each individual profession. And we have some language on this. We could always go with what the statutes and the regulations define for some of the professions. The question really, though, is does that get at something that would be helpful for members of the public to gain a better understanding? It may be a technically correct definition, but is it really helpful for members of the public? So for individuals accessing our website, we thought maybe something simple would be helpful to put up there, but we thought the best place to start would be to come to each of the advisory committees and let them have a discussion, understanding the area that we're trying to benefit here and the groups that we're trying to help clarify some of this for.
Yeah, I'm glad we have.
David,
Oh, go ahead.
David, I think that's a good place for us to go. I do believe it's important. However, I'd like to make sure that I'll bring this up at the next board meeting, that whatever the committees decide best defines, that somehow we push that to the legislature to review and to revise what's in the regulations. So the descriptions, if you will, are consistent and meaningful.
I think that's good.
Yeah, what a great opportunity we have here to really, enhance the way we look at our own identity.
So if I could request, just ask the members of the advisory committee to try to think about the question we've posed and come ready to kind of have a conversation of this in the next meeting, keeping in mind that we're trying to have a definition that is a practical one that still is technically correct, but it's helpful for members of the public who maybe don't have the education in the areas of certain words that may be terms of art in a profession, so we can help more people understand the distinction. So.
It is amazing how many people don't really have an idea of what the differences are.
Also, just for, for information, we also have in our webpage ACA, we also have a definition of counseling.
Mhm.
It's very broad and it's talking about wellness and empowering and career. So, so it's very short and concise. So we don't have to start from zero either.
Mhm. That's a good point. So do we all want to look at this and come back with any ideas and feedback for at the next advisory committee meeting?
That's a yes, at least for me.
Yes, for me. I think it's an opportunity for, this is an opportunity for, again, for us to fine tune how we want to be seen. Okay, so we'll bring it up at the next meeting, at our next advisory committee meeting. We'll continue the discussion and maybe we'll get a landing point.
Will our new members be at the next meeting?
Yes, they should be.
So it would be interesting then to include them in this discussion as well.
Mhm. So once they're appointed, oh, by the way, here's your homework for our next meeting.
Right. Well, but they would be privy to our
I just sent the definition of counseling according to ACA.
Thank you for that.
Mhm.
Thank you. Yeah, they can hit the ground running. I like that idea. Okay, well, it sounds like we know what we need to do there. Additional topics for 2024. We always, we have been leaving that on there on the agenda because if there are any other subjects that we really want to tackle, we should get to it. So if anybody has anything, does anybody have anything they want to add? Okay. Okay, our last thing, he's not here, but we want to recognize Achagoras. He has been very helpful and has contributed greatly, but he had to go off and move to Japan. So how long has he been in Japan, David?
It's been the last few months. I know that he's tried to attend at least one, if not two meetings while he's been in Japan, and it's been very, very late.
Yeah,
when he
3 in the morning.
We could give him a call and bring him into the meeting.
Wake him up.
Not sure he misses us that much.
Right. Probably lots more interesting things to do.
No, but it's been great having him on the advisory committee, and just wanted to say thank you to him for his service on the advisory committee. And I know that he would like to continue to stay on, if not for the technical issues related to being in a location with the time difference that way. So just wanted to say on behalf of the BSRB, thank you to him, and he stays in touch. So.
Well, and if he moves back to Kansas after his stint in Japan, maybe we'll hear from him. It would be great to have him back. So, yeah, we wish him the best. Great. Any other things we need to cover, David Fye?
No, the next meeting is scheduled for August 5th at 10 a.m. But aside from that, no, I think we made a lot of progress today.
We sure did. And I am so excited to have 3 new advisory committee members that will all get to meet in August. So that's terrific. And David, I assume you'll reach out to them and after approval and let them know they've been selected.
Yes, so the next step officially is for those to be provided to the chair of the board for review. And so what I normally do, just to make sure we have all the technical things in place, I'll provide her with that information, and then she'll have the opportunity to appoint those individuals at the board meeting. And then once they're appointed, then I'll reach out to them and let them know they've been appointed and the next steps.
Great. And do we send a letter or any kind of information to the people who weren't selected, thanking them for their time and letting them know?
Yes, whenever the official appointments have been made, then I reach out to individuals who also were not selected this time to thank them and ask that they in the future to serve in the advisory committee if they're interested in doing so. So I'll send it out to all individuals who applied for consideration.
Terrific. Thank you for doing that. Okay, we need a motion for adjournment.
So moved.
Thank you, Jim. Second, please.
Second.
Who was that?
That was
Oh,
me.
thank you, Vanessa. Okay, all in favor, say aye.
I.
Any opposed? Didn't think so. Thank you again for your time today and have a good summer and we'll see you soon.
Have a
Thank
nice summer.
you.
Thanks,
Bye.
everyone.
Thank you so much.